Hi there, this is Dr. Paul Firnhaber. It's time for another 10 minutes of truth here on Wednesday. And as usual, I have a very important article that I wanted to cover. Now, all the articles that I cover I feel are really important because you're not going to hear them everywhere else, or probably anywhere else. So this is current research that I think is important to you and is important to our culture. So this article is called The Impact of 8 Lifestyle Factors on Mortality and Life Expectancy Among United States Veterans, the Million Veteran Program. It was published in the American Journal of Clinical Nutrition, December 7th, 2023. So this article is barely a month old. Very, very important research they did here. So they looked at about 276,000 veterans from 40 to 99 years old. This is the first time that the concept of prevention is being used to estimate life expectancy. It's never been done before. Lifestyle medicine has been proposed as a way to address the root causes of chronic diseases and their associated healthcare costs. So that's what we're talking about here. Lifestyle medicine treats underlying causes of disease rather than symptoms. Non-communicable chronic diseases are associated with greater than 80% of all healthcare dollars. And they contribute to the vast majority of the morbidity and mortality in our culture. Promoting a healthy lifestyle has been proposed as a method for primary prevention of chronic disease and mortality, as well as healthy aging and longevity. So that part was the introduction to this article, to this study. Now we're going to get into really what the study's about. So, as I said, they looked at about 276,000 veterans. Now, about 20,000 of those were women, and so about 256,000 were men. And what they found was that 8 lifestyle factors really contribute to longevity and chronic health. Or, if you don't follow these long lifestyle factors, chronic ill health. And they were able to quantify how much these factors contributed to a healthy, long life. So let's look at the 8. Number 1 was positive social connections. Contribute 5% to a longer life. Restorative sleep, 18%. So if you don't sleep and you don't like anybody and nobody likes you, you've got a 23% higher chance of dying than you would otherwise. Minimal alcohol consumption, 19%. Whole food, primary plant-based diet, 21% to a long, healthy life. Stress management with minimal anxiety and depression, 29%, almost 30%. So managing stress and controlling things like anxiety and depression were even higher than a whole food diet, which I thought was very interesting. Never smoking lowered the risk of dying by 30%. Not having opioid use disorder lowered the risk of dying by 38%. Regular, moderate exercise lowered the risk by 46%. So if you look at these 8 things, exercise was the biggest factor of all. Now, I'm not saying that you can ignore the other factors, but I thought that was very interesting. And I found just in practice, in 42 years of practice, that people that don't exercise tend to break down faster, and it's much harder to get them well. So exercise is really, really, really important. So let's look at some other things that they came up with. Now, by the way, when they said regular moderate exercise, what they described this as walking like briskly for 4 or 5 blocks every day. To me, that's more light exercise than moderate exercise, unless, you consider like gardening light exercise. I don't know, but walking 4 blocks, I would not consider moderate exercise. But in this article, they did, in this study. So if they looked at a male at 40 years old and they didn't do any of these things, they could expect to die at 63. If you looked at a male that at 40 years old that began these things at 40, let's say they didn't do any of this up until 40 and they began them at 40, they could live to 87. Pretty good. So it added quite a number of years onto their life, like, 37 years. So a female at 40, if they didn't do any of these things, they would live to 67. If at 40 years old they changed their life and started doing all of these things, they could live to 87.5 years. Now here's the interesting thing. If you were a male and you got to 60 and you were not really doing any of these things, and you said, I'm going to change my life. I'm going to quit smoking, get off of opioids, start exercising, eat a whole food diet, make some friends, whatever. If you did all 8 factors, you would live another 16 and a half years. If you're a female at 60 and you incorporated all these things into your life, you live another 18 years of additional life. So, if you're out there right now and, you're in your 40s, 50s, or even 60, and, you have some issues in this area, it's not too late. They found that if you changed things, they did it at 40, 50, and 60. And I didn't give the results at 50, just 40 and 60. But if you changed, your body is resilient enough to become healthier and for you to live longer. Now, New Scientist reviewed this article. That's a journal, a magazine. And in fact, I'm quoting it in one of the studies that I'm doing, or one of the talks that I'm doing coming up. But they noted that lifestyle decisions were much more important to the longevity than access to medicines or medical doctors, because none of this includes pharmaceuticals, none of this includes medical testing or medical intervention. It's all lifestyle factors. And remember, the article said that 80% of all diseases and all unhealthy problems that people face is due to lifestyle factors, due to things that we can control above 80%. So think, if we had a healthcare profession that promoted this stuff, think of how much money our culture could save. Now, here's the interesting thing. What if you had chiropractic care to this? What if instead of 8, you had 9? I wonder what that would have done. They didn't do that, of course, and chiropractic care is offered at some VA health centers. But I'm just wondering, if you took these lifestyles plus chiropractic care, how that would have changed the picture. I would bet that it would have changed it significantly, even added more years of health, more years of life. They didn't do that. That would be a very interesting study. So, my advice is to look at these 8 things: positive social connections, sleep, alcohol consumption, whole food diet, stress management, smoking, opioid use, and exercise, and find out where are you on here, and then start doing those things that you're not doing to live a much healthier, longer life. So that's all I have for today. Next Tuesday, so a week from last night, We're going to do a talk in my office at 6:30 on nutrition. Nutrition, eating right for a healthier life and a healthier planet. So we'll see you then at my office, 6:30 next Tuesday. Until then, God bless you.